to look at CSF cerebrospinal fluid characteristics and important points related to CSF. CSF is a fluid which is present in the meninges and it acts as cushion. It has higher magnesium and chloride concentration. A specific gravity is 1.005, pH is 7.33. It is isotonic with serum and sodium is equal to plasma level. Magnesium and chloride is higher in this fluid and creatine is higher than plasma, glucose is lower than plasma, and protein is very low, means lower than glucose. Means in CSF there is very minute concentration of protein and glucose is little bit lower than plasma. Components of CSF are lower than in plasma. CSF production is from ependymal cells in choroidal plexus of lateral ventricles and its production rate is 20 milliliter per hour. Daily production is 450 to 500 ml per day and volume in system is 150 ml and ventricles and subarachnoid space. Lateral ventricles then comes into the third ventricle and then fourth ventricle. So in this way CSF flow occurs. Now it acts as shock barrier. It acts as a protective cushion for brain and meninges and spinal cord. Its normal pressure is 10 to 20 and 60 to 150 millimeter of water and 6 to 15 millimeter of mercury. Now, flow of CSF occurs from lateral ventricle to interventricular foramina of Monroe to third ventricle. Lateral ventricles come into interventricular foramina of Monroe to the third ventricle, and from third ventricle there goes into the fourth ventricle through cerebral aqueduct. Then goes into the foramen lusca and meninges to the subarachnoid space. In this way, CSF flows down to the arachnoid granulation and drain into the dural venous sinus, and arachnoid granulation are visible with naked eye. So, in this way, CSF helps in cushioning and uh, rehydration of nutrition supplement of brain and spinal cord. Indicators of CSF leakage beta 2 transferrin will be raised, and the main determinants of CSF composition are ependymal cells from which CSF is produced. So in this way, CSF is produced and it is very protective thing. It is very important.